go right now. I'm a little preoccupied because we're going to go to Lisa Breck with Dr. Ahluwalia, who we call him Shaky Hand Ahluwalia this morning, getting ready for Maria's knee surgery.
Maria is screaming no. She wanted to make sure he didn't have any coffee this morning, you guys. So there's Maria. She's in there ready to go, checking her weather notes, by the way. So here's Dr. Ahluwalia. Show us quickly what her knee looks like and why we're doing this.
So this is her knee, and there's her meniscus tear. So she's been hurting for almost 2 years and has not really been able to walk comfortably. So today we're going to fix her and make her much better.
I want to find out more about the actual surgery, but let's go check with Miss Maria. How you doing, hon? I know you've been a little nervous and you weren't sure about all of this.
I was. I have to be honest, I was actually throwing up last night.
Really?
I was a little nervous, and my husband knows, and we were ready to cancel it, and I said, if I have a fever, then we're postponing it. But I don't. Everything's fine. It was just my nerves, and I'm in good hands, as you know.
How bad has the pain actually been for you? And I know you wear a lot of beautiful high heels. And
I know. It's been really bad. I haven't been able to wear my heels. I haven't been able to run after the baby, and I've been limping around the newsroom, as you know, since Halloween. So I'm ready for a fix.
Okay.
Dr. Ahluwalia.
And doctor, tell us a little bit more. Come on in. And how long is this surgery going to take? And do you cut her open, or is it through like little holes?
Well, it's less than an hour. We're going to make 2 little poke holes in her knee and go in with a camera just like this one and some instruments, and we're basically going to clean it out. And you get to be in the room and watch.
Yeah, lucky me. How long is the recovery going to be for her?
So she'll start walking on it right away. Initially she'll use crutches for maybe about a week, and then on her own. Probably takes about maybe 4 to 6 weeks to recover.
And this is kind of like, you do stuff like this in your sleep. This is such a common surgery, correct?
It is a common surgery, and Maria, I am awake.
Yeah, the thing is, I never heard of a meniscus. I had no idea what that was until about 3 weeks ago. So I just thought it would be a great learning experience for everybody to see that it's okay. And I know I was nervous, but I'm okay now. I actually feel really, really, really good.
Okay, so Dr. Ahluwalia is doing it. Yes.
Yes, I am doing it. And
he has a question. Let me go ahead, Steve.
Yeah, Dr. Ahluwalia, Sonu, good morning to you. How often do you do the surgery on women in full makeup?
And how often do you do the surgery on women in full-on makeup?
Believe it or not, more often than you think.
Los Angeles.
It's LA, right?
We are in Beverly Hills, Steve.
Oh, even better.
By the way.
By the way. Oh, no.
We had to make sure that he's going to do it on the right knee, so we had to mark up. We had to mark up the right knee. See?
And show us exactly where it's going to be.
Well, I have an ugly knee here, but no moisturizer on there.
They say bad handwriting, good doctor.
But see, here, it's the right knee.
One little cut here and one little cut there, and that's all. And her knee's going to look beautiful again.
One good-looking knee.
And Maria will be knocked out for it? Is that true?
And will she be completely under for this, right?
Well, she'll be asleep, but not under general anesthesia. And we have the best anesthesiologist here at Lapeer. And we're going to do some blocks and things to make her leg numb so she doesn't feel any pain. So she'll basically just be sleeping like a colonoscopy or something like that.
And it will take about 45 minutes, and then we'll be able to check back in with you guys.
Yes,
right?
for sure.
So around 8:30, we're hoping to be back.
Are you going to administer propofol? I'm wondering, propofol?
Propofol?
I assume so, yes.
Yeah.
She's been asking for it.
Are you kidding?
I've actually been asking for my milk. Yes.
Oh, well, God, okay.
Okay. So we'll check back in with you guys in about an hour, and Maria will be like brand new.
Yeah.
I'm just
Good luck,
joking, you guys.
Maria.
Here's the weather. I'm paying attention, Maria.
Yeah.
Oh, good. Don't pay too close attention.
MyFoxLA.com.
I have like secondhand nervousness.
Thanks, you guys.
Maria Quaban went under the knife, so to speak, to have her knee repaired, her meniscus repaired in her knee. Let's go to Lisa Breck. Let's see if she's wearing the hat. Yeah. There she is with Dr. Ahluwalia, whose hat is so much nicer.
She's looking great.
She looks great.
Dr. Ahluwalia.
Steve, you're just jealous you don't have the hat.
How is she doing?
Maria is doing great. She's doing great. She did great. We can't quite talk to her just yet, right?
Yeah, she's still sleepy. The surgery went really well. And, you know, both her menisci were torn. And as you saw, we took care of both of them. So now her knee's going to be good.
It's fascinating. She didn't want video in there, but I did take some pictures. And to watch the little flap what is it that you need, meniscus that needed to be torn and basically then teared and cut out and vacuumed out almost.
But you can imagine how that thing was flipping in and out of the joint and causing so much pain for her. So I think this is really going to be good for her.
Let's go over and look at the pictures real quick. This is what it looked like before. And by the way, Steve and Maria, I just have to let you know, every doctor here looks like they're in Grey's Anatomy, even the anesthesiologist, right?
They just don't behave that way, but they...
So it's casting.
Okay, so here's where we're looking. And see that little thing at the bottom there? That's the flap that was flipping in and out of her knee, and that's the part that we took out. So she's lost a little bit of her meniscus, but now it looks nice and smooth, and I don't think it's going to be bothering her anymore.
I have a question
the doctor's getting ready to...
Yeah, I'm sorry. Dr. Ahluwalia, oftentimes people have a situation where the meniscus kind of slips out of place and can go back in again without surgery. Am I correct?
Yeah, but you know, she's been suffering for 2 years, and that's probably what happened. It flips out, it hurts her, then it goes back, and it becomes okay. And I think that she just kind of, you know, got tired of doing that, and that's why we decided to do this.
And it looks so pretty to see the video, watching it happen, absolutely fascinating. And we should be able to talk to Maria maybe in about 20, 25 minutes while the doctor's in for his next surgery. So we'll have that for you.
She's a little loopy right now, is that what you're saying?
She's a little loopy.
Okay, all right.
Steve, be careful of what you ask her. She might give you some honest answers.
Yeah,
Whoa.
stuff you don't want to know.
Okay.
Yeah.
Dr. Ahluwalia, thank you, and Nurse Breck, thank you very much. Okay.
You may have noticed Maria isn't with us today. That's because she is recovering.
Yeah, from meniscus surgery. We have Lisa Breck there, who basically has been holding her hand while Dr. Ahluwalia performed the procedure.
Hey, Lisa.
It was so fascinating to see. And how did she do, doctor?
She did great. And, you know, the surgery went really well. And when you see her, you will be surprised.
Watch this. Okay, Maria, come on. She's practicing on her crutches, already up. How does it feel?
You know, I don't feel any pain at all. I mean, I feel confident even without the crutches, but I think for safety, I should have it.
Yeah.
Dr. Ahluwalia,
Yeah.
thank you.
Yeah. None of my surgeries hurt.
What's her deal for today? She's like, Maria, it's not a race right now. You don't have to go.
Oh, okay.
What's the procedure for her today?
So today she's going to take it easy. She's going to lay low. Her husband's going to cook for her.
Did you hear that, honey?
And then, you know, she can walk on it. She can get around the house. We'd rather she not overdo it today. She's going to be kind of sleepy, maybe a little out of it. And then starting tomorrow, she can start to do more and more.
And when will she be back in her heels in front of the weather wall?
Well, she's going to come see me on Friday, and then we'll decide. Hopefully Monday we'll have her back.
Okay. And how'd the nerves? I know you were so nervous last night, and you were getting sick because you were so nervous.
I was really nervous, and as soon as I got here, Dr. Ahluwalia really made me feel comfortable, and the nurses, and I felt good, and I feel good now. So I'm really, really excited to have my old knee back.
Okay, good. Well, we'll let you walk. And again, this was your second. You've now performed 2 surgeries today.
Yes.
That's brilliant in there. Okay.
Okay. Bye, guys. I'll see you next week.
All right,
We'll see you soon.
feel better, Maria.
Yay! Looks great.